Hey everyone, Dr. James is right here. Excited to have you. Today I am absolutely stoked because we are going to be talking about a topic that is one of my absolute favorites. I have helped more people in this avenue than almost anywhere else. We're going to be talking about women's health, but specifically testosterone therapy, correct management, who needs it, why take it, and when it's done correctly, how it can help you. So this is going to be a full guide. I've never done this before for testosterone therapy for women. It's something that is completely misrepresented on the internet, not even discussed. Women are, one, not actually even getting their levels checked at all when it comes to a full hormone panel when they go to other providers. If you're another provider, you've pretty much just struck gold because I'm going to give you the golden keys to management. Women with testosterone, why would you do it? When would you do it? How would you start it? And we're also going to be thinking about this from the terms of the patient. So if you are a man that is having women that are struggling with the things that we're going to be talking about, so if there's a woman in your life that's having this type of an issue, you're going to know how this should be managed from a testosterone point of view. Or if you're the actual patient, if you're a female that is struggling with these issues, you're going to be completely empowered with the knowledge to be able to go to your doctor or even a hormone specialist and be able to say, hey, this is what I heard, and can we implement this? And I think that you'll find that doctors are more receptive when you come to them with specifics. So today I bring you specifics. Let's jump right into it. So why care about testosterone? So I'm going to talk to you as if I was talking to a patient. I would care about testosterone because testosterone is a hormone of recovery. Our bodies directly use testosterone to go into cells, goes into cells individually and enhances recovery of those cells. It does this throughout the body. So if you can picture, we use testosterone in our bloodstream to supply cells after a workout, after a tough day, after an injury. We need testosterone from an anti-aging standpoint and a recovery standpoint to be able to heal, to be able to regenerate. Okay? So that being said, testosterone is responsible for a ton of other things too. It's also responsible for components of our sleep. It's also responsible for components of our sex drive, overall energy, overall sense of well-being, and overall sense of motivation during the day. So when testosterone levels are low, you'll notice that it has an impact on every single one of these things. You may only notice it in one individual area, but testosterone, when it's low, will impact those areas, right? So poor wound healing could be low testosterone. And so this is extremely important, and we should care about it because most doctors, when someone is reporting these types of symptoms, right? So low energy, low motivation, low drive, low sex drive or libido, poor wound healing, when they're reporting these things, we think of other issues, right? Like, hey, get more sleep, or hey, let's check your other hormones, your estrogen and progesterone, and see what's going on. And they might be right to look into those other hormones or these other issues or thyroid or whatever it is, but we're often missing the mark when it comes to women and testosterone. It needs to be viewed as the equivalent of men because testosterone essentially has a very, very similar in women, or a very, very simple function, very, very similar function in women as it does in men. Right? So in men, if you think about it just contrastly, if you got a guy who's really tired all the time with low libido, not motivated, starting to put on some weight, losing muscle mass, testosterone impacts muscle mass, then immediately anyone would be like, oh, this guy might have low testosterone. We better get that checked out. But what happens to the exact same stuff's happening in women? It's always like, oh, you're probably anemic, or you probably have low thyroid function. No, the exact same is usually the case when it comes to women as well. So it must be identified. You need to get tested. And when it comes to this, you really need to get your free and total levels tested. I like to also test SHBG. This is sex hormone binding globulin. So with SHBG, that is what takes the total testosterone and binds to it and puts it in storage and labels it not for use. So the free testosterone is what's bioavailable, floating around your body so that your body can actually use it for recovery. Use it to gain muscle, right? And so you need to be able to check your free and total testosterone. I like to check the SHBG as well. I want to segue before we go further to a really, really important story. Happened about 6 or 7 years ago. I had been experienced with testosterone therapy in women, but until that point had only been using creams on my patients. And so with these creams, I did notice some benefit for them. I did notice, like when we talk about those symptoms before, energy, sex drive, increased muscle, minimal positive benefit, but positive benefit nonetheless, right? And I'll go into a little bit later why that is, but I had not had experience with other forms of testosterone therapy. And I was paying for mentorship. Let's call this person Dr. T. And Dr. T was a female in her 40s, and she was also well-versed with treating women with low testosterone. But in a conversation with her one day, we were talking about how we treat our patients for certain symptoms, low testosterone. What do we do for libido? And what happened is I ended up having like the most mind-blowing discussion with her that really changed my thinking, and it opened my mind to other possibilities in the form of treatment for women. So Dr. T told me, hey, with all my patients, we do testosterone injections. And immediately I'm like, testosterone injections? Are you crazy? But let's pause for a second. The best way to do testosterone therapy in men is injections, right? Women might need a lesser dosage, but the best way to do testosterone therapy in men is injections. Why not apply that to women? Just food for thought, right? I hadn't thought of that. But she says, yeah, I inject them once a week. It's set it and forget it. It has less of a likelihood to change to other versions of the hormone, and you only have to do it once a week. It's super easy. And she said, that's what I use on my patients, and it works super well. So Dr. T, what her specialty is pain management, injections, PRP, prolotherapy. So she says, I use testosterone as a way to actually decrease inflammation and speed up the healing process. Because remember, testosterone is a hormone of regeneration. Why would we not apply that when it comes to the healing process? This is why now, when someone has surgery, and their doctors tell them to come off everything, and they come off their testosterone for like 6 weeks after the surgery, I'm like, that's freaking crazy. Why wouldn't you stay on why you can come off it for the day of the surgery or whatever, or for the week of the surgery, but get back on it afterwards. Increase that healing, right? Anyways, that's just a little segue for me. So Dr. Tina is specializing in pain management. She's doing this with her patients. She's seeing drastic results in healing time, process, and people's joints healing, and all this stuff, all this awesome stuff. Feeling more energized, motivated. And here's the ringer. Here's what sold me. She said, I've been doing this myself for the last 5 years, and it works beautifully for me. I inject myself once a week, and I feel great all the time. I feel better now than I did in my 30s. And I'm like, mind blown. All right, I'm willing to try this with a patient or two, even though I was kind of sketched out with the whole thought of injections. Well, fast forward now here almost 6-7 years later, and this has actually been the game changer when it's come to so many patients' treatment plans. The thing that really pushed them over the edge, the thing that really, really, really ramped up healing for them and caused people to just feel better, get rid of inflammation, heal faster, just overall take control of their health, has been testosterone therapy, okay? And I want you to consider this thought for a second. When it comes time for me to work with a patient, typically there's a lot of lifestyle stuff that needs to happen, right? They need to change their diet. They need to start exercising. They need to stop doing all this stuff that's detrimental to their body, okay? But consider this, all right? They're exhausted. They're not motivated. They're not sleeping well. They're gaining weight. They feel like they're stuck in this downward spiral because of the low testosterone, and maybe some other stuff going on too, but testosterone's always playing a role. Well, how are you supposed to get that person out of that rut, out of that hole, if their testosterone level is like 0, right? You say, hey, just start waking up early, start doing X, Y, Z, and eating better, and you're going to feel better. And the truth is yes, this person in that state will feel better, but they will have to push themselves and find energy that they do not always have. So when I say consider this, consider the fact that they go on testosterone therapy as a female. They're injecting themselves once a week, and all of a sudden, boom, they start feeling a little better, a little bit more energized, a little bit more motivated, a little bit more drive. Starting to notice they're not even doing much different, but a lot of times people notice blood sugar will start coming down, cholesterol will start coming down, all these little positive benefits. That gives them the motivation and the energy and the power to then go forth and actually make the lifestyle changes that are going to make the big difference in longevity in the long run. So what actually causes this decline of testosterone to begin with, right? You might think to yourself, testosterone? I'm not low in testosterone, but you're having some of these symptoms? That's not possible. And it's just like a guy. I see men in their 20s, low 30s, by the time they come to see me, guys that are not feeling that great, testosterone's always low. I would put women in the same boat, okay? The same stuff that makes a man's testosterone decrease is going to make a woman's testosterone decrease. Now, testosterone in women is produced differently than men, but it's the same type of stuff that shuts down production of testosterone. So in men, testosterone is produced in the testicles, and the brain tells the testicles how much testosterone to produce. In women, it's actually the ovaries. That's like the female version of the testicles. The ovaries produce. Now, over time, you're going to lose function of the ovaries. As you progress and progress and progress, 30s, 40s, you're going to slowly lose some of that function and some of that testosterone production just as a normal aging process. As a woman enters into perimenopause or menopause, the ovaries stop functioning almost entirely, and then the female body has to rely on other means of making testosterone, namely from DHEA, but I'm not going to get into that in this training. So why do so many women have low testosterone prior to perimenopause, just like men do prior to andropause? It's because there are many factors in our westernized, civilized world that we live in, lots of things that block hormone production, block testosterone production. I mean, it even comes down to all these things that are nickel and diming us, right? Wi-Fi, we know blocks hormone production. I mean, but we can't really worry about Wi-Fi because it's everywhere. You know, if you do, you're gonna have to move out into the woods like a crazy person, like a hermit, and never come into town, right? We don't want to live our lives that way. So it's not practical. So we need to focus on the things that are. So what is practical? And we need to think about hormone disrupting chemicals and things that we're putting in our body or being exposed to that are blocking testosterone production, because that is why testosterone production goes low to begin with. So rule of thumb, in women and in men, what blocks testosterone is anything that causes stress on the body. Whether that's emotional stress, like PTSD, emotional stress, fighting with a spouse consistently, terrible job life, sitting in a computer all day just hating your job. Like, these are the types of stress that will actually raise your cortisol levels, and cortisol is going to block growth hormone, it's going to block your testosterone production and cause other things to happen, blood sugar to go up, and blood sugar goes up. There's insulin problems further the decline of testosterone. What percentage of people are overweight? It seems like most people these days are somewhat overweight, and that means that there's metabolic syndrome in play, insulin issues in play, further blocking testosterone. So just strictly from a emotional standpoint, stress standpoint on the body, you're going to have that. A bad night's sleep increases stress. If you're having consistent poor sleep, this is what's going to happen. You're going to get testosterone suppression. Blood sugar issues, again. So diet comes into play. What you're putting in your body really, really matters. And the quality of the food matters as well. So the other thing that can become a huge issue when it comes to chemicals is the chemicals on our food. So this is why I recommend that people eat organic food. They don't eat non-organic food. And if you're curious about if you're on a budget, if you're balling on a budget, and you want to know which foods are worst and you have to buy organic, go to ewg.com. It'll tell you Dirty Dozen and the Clean 15. So the Clean 15 is a separate list that tells you the foods that are good, that you can buy non-organic, and that aren't going to hurt you very much. The Dirty Dozen are the ones that you must buy organic. And that will help you because those chemicals, those pesticides, they're known to cause significant problems when it comes to our hormone levels. They've seen it in mice, they've seen it in other animals, and they've seen it in people. So we have to pay attention to this. Otherwise, like, where does all that stuff go? It all ends up in the water supply. And so our water, if you're on a city-based water, then you must have a filter. Otherwise, you're going to be getting chemicals that are definitely blocking your hormone levels. Again, EWG.com has basically this little application where you plug in your zip code and you select where your water is coming from, if it's city water, and it tells you the contaminants of your local water supply. And so, for instance, our clinic, Blue Water Medical, is in Snoqualmie, Washington, and I think there was, like, last time I checked, there was like 2,000 times, maybe even more than that, 2,000 times the amount of arsenic in their local water supply than is recommended for consumption on a daily basis, which makes me absolutely sick that we have families up there that are consuming this. Arsenic causes cancer and a bunch of other bad things to happen, right? So anyways, segue, but we have to filter our water, and that was a very easy way for you to be able to do it. Of course, mold is another issue, so let's not be living in homes with black mold. Here in the Pacific Northwest, this is a huge issue. Please look into that. Otherwise, plastics are also a large concern. Use glass Tupperware, steel containers for your water, no plastic water bottles, no plastic Tupperware, because these things block our hormone production. So those are all ways that there can be a natural decline in testosterone. And in many women, this decline is far enough to cause physical problems. When these levels get low enough, then we need to do something about it. And one of the ways that I like to deal with this in women, particularly over the age of 35, is testosterone replacement therapy. So testosterone replacement therapy, for me, I've just mentioned before that I've used the creams and saw minimal benefit. As soon as I started using the injections in practice, I thought like the first 5 to 10 women, it was a fluke. These people will start injecting and they'll come back the next time I see them and they'll be like, oh, I'm doing so much better. Yeah. Like 80% of their problems are just gone. Like it just starts to clear stuff up for people because you're healing faster again. And that makes all the difference. And then all of a sudden now they're willing to listen to this crazy naturopath about what type of diet they should be eating, how much they should be exercising, what type of stuff they should be avoiding, taking their supplements and remembering to take them. Now all of a sudden I give them testosterone and they're like, yeah, I feel like I can do all this stuff now and I'm getting great results. And then they are able to do those lifestyle things and they're going to get even better results. So I started seeing in practice phenomenal improvement. And, my patients were getting better before, but when I started doing this, it was like, I'm like, dang, how come people don't know this? This is my best kept secret of practice. This is my best kept secret. And the best thing that I can be doing is sharing because hoarding this information is, I feel like it's doing people a disservice. So what other forms of testosterone therapy are there out there? They're the creams, right? So you put up the cream on the skin. Issues with the creams are that the rate at which we absorb them is going to be different from person to person. You're supposed to put it on thin skin, right? And when you get it on thin skin, it's going to absorb differently than on skin with hair or thicker skin. The issue is that the lines are very muddy in how it is absorbed. If it's absorbed through thicker skin, then it tends to turn into other hormones that cause women to have other side effects, like basically higher other levels of hormones. The testosterone gets converted into other hormones that can cause problems, can cause hair loss, can cause acne, cause all this other stuff that I really don't like to see in my patients. When we use injections, we just don't simply see this. The user rating for me, anecdotally, is off the charts higher. People are like, oh my gosh, I love this stuff. As soon as you can get over the fact of injecting this tiny little needle. It's done subcutaneously, and I start women off at 10 milligrams per milliliter. So this is like note, highlight, 10 milligrams per milliliter, as opposed to men at 200 milligrams per milliliter. So that shows how small the dosage is. And I do 0.6 milliliters once per week. If I start a woman on this, I might have to change the dosage, but not by much. And it's usually a game changer. I like to manage every 12 to 14 weeks after we start therapy to keep things safe and to recheck everything and make sure that we're making progress. But most of the time, we don't need to change it at all. The next form is actually the pellet. And this has been, in the last couple of years, the thing that's been all the rage. We want pellets because the pellet is surgically inserted into the skin, and then it's set it and forget it. The issue with this is that we cannot control the rate of absorption from the pellet. What I typically see is you can either overdose or underdose a person. And in most women I see it's actually overdosed. So I test the blood or the urine, and I'm like, oh my gosh, this woman has 10 times the testosterone she should in her body right now, consistently. And it's valid. It's in there for like 8 months, 6 to 8 months. Like, that's a long freaking time to be overdosed on testosterone. And a lot of women, like, too much testosterone is just as bad as not enough. There's gonna be other symptoms, right? You can feel edgy, you can feel aggressive, you might get acne, you might have hair loss. We just don't want any of that stuff. So stay away from the pellets. Not to mention, if you want to get it out, you have to surgically cut it out. Who wants that? No. The cool thing about testosterone therapy with injections is once you start it, you can keep doing it, you can stop at any time, and you can change the dosage. There's just so much control and flexibility with it as a therapy once you get past the fact that it is a tiny little injection. Okay, so I do want to touch on testing for just a moment, because testing is a big part of the issue. I see a lot of people where they do get a total testosterone checked, or even a total and free testosterone checked, and their doctors are like, no, it's normal. Then I see it and I'm like heck it is, because their levels are like at the bottom end of the normal range, or their total testosterone might be like normal, like in the mid range, which is fine. Most women I check are actually mid range for total testosterone, but their free testosterone levels are like almost zero. So that's like someone saying like, hey, you have some testosterone in the body, but you can't use any of it. Your body is unable to use any of it right now in this current state. So as a provider or as a patient, you might think, well, does that mean I can still do testosterone therapy? Absolutely. In my experience, women that have this scenario happening and they get on testosterone therapy, they feel so much freaking better once they get on testosterone injections. It's unreal. And so don't think just because you have normal total testosterone levels that you can't do testosterone therapy. So that's what I would say. Usually I see women around a 1 for free testosterone when they're really not doing well, between 1 and a 2. And we do testosterone therapy with these individuals, and they will always feel better, 99 times out of 100. And I've done this now in the last 6 years. I've done this with hundreds of women. And so it's like, you see the trends. If there was a problem, then we would know about it. So let's talk about side effects for a second. So side effects for testosterone therapy, when injected, I'm not going to talk about creams, I'm not going to talk about pellets. When injected, side effects are incredibly minimal, okay? There's very little reason why you'd want to do testosterone therapy unless somebody has like severe hemochromatosis, or they have way too many red blood cells, or they have active cancer, or they're just very, very unwell. I still may consider testosterone therapy in some of those individuals, but it would be on a case-by-case basis. So if you got a lot of stuff going on, you just got to get checked out to know if you're a candidate. But side effects, very minimal. As far as like acne and agitation, maybe if someone's really overdosed, but not usually at the dosages we're talking about. Because we're talking about physiologic dosing here. We inject the testosterone, it may go up a little bit above that 5 pg per deciliter mark. Like maybe it goes up to like 5 or 6, 7, and then it kind of starts to go down throughout the week, and then you inject again. And it's like the levels are never falling lower than you would make on your own at your low level. And that causes women to feel balanced and not like they're getting a ton of testosterone and then it's all gone and injecting again. That's not what's happening. We're keeping them in that upper 80%, 50 to 80% all the time. And people tend to feel great. And when you do it this way, and when you do it correctly, you don't need to inject like 2-3 times a week like some clinics do. Otherwise, I will give you one pitfall that I see. When women are injecting testosterone, if they're taking oral DHEA, sometimes I see cystic acne around the jaw here. And so I just, as a result, from seeing this enough times, I just take women off DHEA if they're taking DHEA when starting testosterone therapy. Now, why would someone be on DHEA? DHEA is a precursor to testosterone, and so some women will take this to try to increase their own natural output. I find that this works. Results are modest at best, and I like to use testosterone therapy instead, but I don't like to do both at the same time. And there you have it, guys. So testosterone therapy, it can be such a game changer. If you are having like numerous health conditions, if you're tired, unmotivated, your blood sugar's creeping up, your doctor just told you that you're at high cholesterol, and you're above 35, 40 years old, and you're just feeling like, man, I'm putting on weight, or you're perimenopausal, and you're like, well, my estrogen and progesterone are definitely going down. Well, your testosterone is definitely going down along with it, and this is something to be at least taking a look at. You got to get on the map. You got to get checked. Whether you're 35 or 45 or 55, you need to know where your testosterone levels are because they have such an impact on longevity, heart health, neurological health even. And we didn't even get into that. We didn't scrape the surface on that. Testosterone is important for these things. But I'm talking about the anti-aging effect of recovery, feeling and looking your best, having a healthy sex drive, like waking up in the morning and feeling well rested, sleeping well at night. Like so much of this stuff relies on testosterone that if you're not even getting it checked, then you have no idea what's going on if you're experiencing any of those symptoms. So anyways, you guys, if you're a Washington State resident, I am accepting new patients. I'd be happy to see you. I'd be happy to check you out myself and take a look at your blood work and review that with you. And if it does come to it, testosterone therapy may be a solution for you. Otherwise, try to find a functional medicine doctor or testosterone doctor in your state or area that specializes in this. I'm always happy to consult, but just know that I cannot prescribe. If you guys like this material, if you're like, this is a great full guide, then please, and you want to see more material like this, please subscribe, like the video, and actually just shoot a comment in there and be like, hey, cool, or do something that helps the algorithm, helps more people see it. And I really think out of everything I've ever made that this is so relevant for women that are struggling, and it could be such a useful therapy. And so if you guys wouldn't mind supporting me in that, I'd appreciate it. And until next time, take care.